Hello, everyone. I am Dr. Jeanette DeWitt, and this is my Tuesday Facebook Live series. I am a physical therapist and athletic trainer and a fitness coach. And today we are going to talk about bone health. And are you at risk for osteoporosis? This is a very important topic, and so important that the United States Bone and Joint Initiative has created a public education program called Fit to a T to address the osteoporosis issue. Now, I just want to preface that this is a great organization. The United States Bone and Joint Initiative is a collaborative effort that includes the American Academy of Pediatrics, the American Occupational Therapy Association, the American Physical Therapy Association, Arthritis Foundation, Centers for Disease Control and Prevention, and many, many other more very reputable quality type organizations. A lot of the information that I'm going to talk to you today about is from their website. So if you want to look up more information in greater detail, or if you want to know more about the United States Bone and Joint Initiative, I suggest you just Google that information or Google Fit to a T, and some of the information that I'm talking about will be highlighted from there. I'm also resourcing information from the National Academy of Sports Medicine and their Essentials of Personal Training text. They have great information on how to exercise appropriately if you have osteoporosis. And then I've also addressed a book or referenced a book by Melvin Williams titled Nutrition for Fitness and Sport. And some of the nutritional information that I talk about in today's class is going to be from his text. So I just want to give a shout out to those three references because they worked really hard in providing information, and I'm just passing that on to you so that you have reputable resources that you can look into for yourself. Now, osteoporosis means porous bone, and it is a medical condition. Osteoporosis is a medical condition where the bones start to thin and get weaker. This can increase the likelihood of fractures, and especially in someone who falls. So if somebody with osteoporosis has weaker bones and thinning of the bones and they fall, they're more likely to experience a fracture than someone who does not have osteoporosis. Now here's a statistic taken directly from the United States Bone and Joint Initiative website. 1 out of 4 people with a hip fracture due to osteoporosis ends up in a nursing home for long-term care. 1 out of 4 people. And out of those, another 1 out of 4 is greater or at greater risk of dying within the first year after that fracture. And this is especially true for men. So I just throw that statistic out there because osteoporosis is a serious medical condition, and it really puts people at risk, especially if their balance is off and they fall. Now, I'm going to teach you today 6 strategies to take control of your bone health. And the first one is know your T-score. You want to work with your physician to learn what your T-score is. The T-score is going to tell you information about your bone health. It's going to tell you how weak or how strong your bones are. The T-score is actually a measure of your bone density and its susceptibility to fracture. So that knowing your T-score is crucial to understanding your risk for osteoporosis. You want to discuss your options if your T-score does not fall within the recommended range. So talk to your physician about getting the T-score, and then based on the results, if your T-score is not in an acceptable range, then you want to talk about options with your physician on what to do next. The second thing that you want to do to take control of your bone health is to know the risk factors that make you more susceptible to osteoporosis. For example, let's start with gender. Gender is a risk factor. If you are a woman, you are more likely to have osteoporosis or have the risk of osteoporosis than if you are a man. Your age. As your age increases, you are more at risk of developing osteoporosis. Your body size. If you have a low body weight or if you've had an eating disorder, you are at more of a risk for developing osteoporosis. This is specifically true if you are under 127 pounds. That is the research-based body weight. If you are under 127 pounds, you are at more risk for osteoporosis. If you have a family history, if someone in your family, your genetic history, has osteoporosis, then you are 60 to 80% more likely to have osteoporosis yourself. Medication. If you've been taking long-term steroids, like prednisone, which is in the corticosteroid family, or if you've been taking anti-seizure medications for a long period of time, these are also going to increase your risk of osteoporosis. If you suffer from other medical problems or medical conditions, and here there's kind of a whole list of these, such as rheumatoid arthritis, hyperthyroidism, hyperparathyroidism, type 1 diabetes, kidney disease, liver disease, inflammatory bowel syndrome, chronic obstructive pulmonary disease or COPD, anorexia or other eating disorders, all of these are going to increase your risk of osteoporosis. Another factor would be hormone levels. Low sex hormones like testosterone or estrogen will increase your risk of osteoporosis. In fact, it is decreased estrogen levels that is the most common cause of osteoporosis in women. Some dietary issues such as low calcium or low vitamin D also increase your risk of osteoporosis. These two nutrients, both calcium and vitamin D, are very important in creating a bone healthy and bone building diet throughout your entire lifespan. So any young girls growing up, I really recommend that they're getting at least the recommended daily amount of vitamin D and calcium, because then they're setting up their growth for really good bone health. An inactive lifestyle is also a risk factor. People who are sedentary are more at risk for osteoporosis. Some of the best exercise that you can do is weight-bearing exercise of 30 minutes per day. That is going to help you decrease your risk of osteoporosis. And the last two risk factors are smoking and drinking excessive amounts of alcohol. So smoking damages the bone cells and prevents bone growth, and drinking excessive amounts of alcohol, about 2 to 3 ounces of alcohol per day, if you consume more than that, you are increasing your risk of osteoporosis. Now, the number 3 strategy for taking control of your bone health is to know the warning signs of osteoporosis. And there's 3 big warning signs. You've had a history of a broken bone or a fracture. You have back pain, or you have spinal deformities like scoliosis, and you have loss of height or the presence of a Dowager's hump. So people who have a Dowager's hump, it's usually in the upper mid-back to lower neck region, and they have other bony deformities potentially as well. So those 3 risk factors: a history of a fracture, a history of back pain or spinal deformities, and then loss of height or the presence of a Dowager's hump. Those 3 are going to increase or create warning signs for you that you're at risk for osteoporosis. The 4th strategy is being active. So I mentioned above, one of the big risk factors for osteoporosis was inactivity or a sedentary lifestyle. So one of the strategies that you can do to take control of your osteoporosis or your risk factors would be to be active. And this information comes directly from the National Academy of Sports Medicine, the NASM, Essentials of Personal Training. And what they recommend is they answer the question of what type of exercise is good for someone with osteoporosis once it's been diagnosed. And there's, to quote the text, exercise regimes that combine resistance training to increase bone mineral density with flexibility, core, and balance training to enhance proprioception with weight-bearing exercises are great for stimulating bone growth. So that's what we want to look at, is resistance exercise, weight-bearing exercise, and exercise that's going to focus on flexibility, core strength, and balance. These exercises should include large muscle groups for your hips, thighs, back, and arms, because you want to support your bones by having stronger muscles. It doesn't mean you're creating bulky muscles and increasing your muscle mass like a bodybuilder. It just means that you're increasing your muscle strength so that your muscles are where they're attaching onto the bones are contracting and relaxing, and that weight-bearing exercise and resistance training can help bone cells to actually stimulate their growth. Now, exercises that you should avoid are going to be any exercise that puts extra load on the spine, such as a squat or a leg press. These should be avoided in people with osteoporosis because it's increasing the spinal load. And when you increase the spinal load in someone with thinner bones, you can actually create fractures in the spine. So we don't want to do anything with excessive spinal loading. Keeping a neutral spine and using core strength is definitely fine, because you're not flexing, you're not extending, and you're not putting a load onto the spine. Now, the fifth strategy that you can use to help work with your, improve your strategies for fighting against osteoporosis are going to be eating a healthy, well-balanced diet that includes calcium and vitamin D. Let's talk a little bit about the role of calcium. The calcium is involved in all types of muscle contractions, and this information is going to be from the text by Melvin Williams, Nutrition for Fitness and Sport. So, like I said, the role of calcium is going to be involved in all types of muscle contractions. This includes the heart muscle, the skeletal muscle, and smooth muscle that's found in blood vessels. Calcium will activate enzymes that produce and break down glycogen, and glycogen is the stored form of glucose, and glucose is giving you the energy you need. It's sugar. It gives you the energy that you need so you can do all the activities you want to do without bonking in the middle of the day. So calcium plays a factor in what happens with that glycogen. Calcium also regulates nerve impulses, blood clotting, and hormone secretion. So it's a big role in a lot of factors of your body. And all of these daily functions are functioning because the calcium levels are at their normal level. If you have low calcium, it's not just going to affect your bone health, it's going to affect multiple systems within your body, your hormones, your nerves, your muscles, and your bones. So if we look at what type of products should I be eating or ingesting, we want to look at dairy-rich foods, because dairy-rich or calcium-rich foods are dairy products. Obviously, if you have a dairy intolerance, you want to work with the dietitian to make sure that you're getting a calcium-rich diet to help with your bone health. Let's also talk about the role of vitamin D. And vitamin D plays a central role in bone metabolism through its effect on calcium and phosphorus. So there's a link between calcium and vitamin D. Vitamin D helps absorb calcium phosphorus from the intestinal tract, and then it deposits these minerals into the bone. So there's a direct link between vitamin D and calcium and depositing minerals into the bone for your bone health. What is the best way to get vitamin D? Yes, you can take supplements, but you can also just expose your hands, your arms, and your face to sunlight 2 to 3 times a week for 20 minutes each. That is without sunblock. If you're going to be out in the sun for extended periods of time, I definitely recommend sunblock. But for the first 20 minutes, 2 to 3 times a week, you can get the vitamin D that you need by the sun or through the sun. Now, the 6th and final strategy for promoting good bone health and taking control of your bone health is seeking out a physical therapist. Consulting a physical therapist to learn how to exercise safely without increasing your risk of injury is crucial to bone health. Remember, I talked about having good core, having good balance, having good flexibility. These are all excellent ways combined with resistance training and weight-bearing exercise to improve your bone health. But you want to do that safely. If you've not exercised in a long time, or if you've come off of an injury and your fitness isn't all the way back to where it should be, a physical therapist can help you with that, because physical therapists are movement specialists, and we can evaluate what your strengths are, what your weaknesses are, and where you can improve so that you're not putting extra stress on your bones or on your joints, or not loading your spine with unnecessary forces. The other thing that physical therapists can do is they can take the information from the evaluation and prescribe a specific exercise program for you. For example, when I treated patients with osteoporosis or who are at risk for osteoporosis, I encourage a slow progression into exercise if they haven't exercised for a while, or if they've come to see me because of an injury and we want to take them back into an exercise program or integrate them back into their fitness program gradually with modifications. I also specifically add exercises that include weight bearing and that include light resistance exercises. When I talk about resistance exercises, I don't mean loading up with lots of weight. That's actually one of the worst things you can actually do, is put on too much weight and really load the joints and load the spine. But using easy and light resistance with resistance bands or body weight is a very safe and healthy way to promote bone health and just general fitness. So it's important to find a physical therapist who specializes in working with people with osteoporosis so that they understand what the patient can and cannot do based on that osteoporosis condition. I encourage you to utilize these 6 strategies. If you have never received your T-score, I encourage you to work with your doctor and find out what your T-score is so that you know the risk of or where you are with your risk of osteoporosis. If you are a physician group and you're watching this presentation in this class, I also encourage you to reach out to me at 262-842-2220, because I'm definitely willing to come out and present the Fit to a T class in more detail to any physician group or any patients, or if any organization would like me to come out and present, I'd be happy to do that. If you have questions specifically for me about an exercise because you are suffering with osteoporosis and you have concerns, please reach out to me at that same number, 262-842-2220, and I'd be happy to start a conversation with you. You can also reach me by email at Jeanette@DeWittPTWellness.com, or feel free to leave a comment in the chat, and I'll be happy to get back with you about that as well. I hope this has been educational for you. It's very important to check your bone health and work with your doctor to know your T-score. That's the first step that you need to take. And then let's have a conversation about getting you on track with exercise and making sure that your nutrition is up with calcium and vitamin D so we protect you from getting osteoporosis. Know your risk factors and know that you can consult a physical therapist like myself, and we're happy to converse with you and happy to help you get started in fighting against osteoporosis and promoting good bone health. Thank you so much for your time today. Have a wonderful day.